Hello everyone, my name is Saisha and today I'm going to talk about the topic MERS-CoV, MERS coronavirus. So MERS is Middle East Respiratory Syndrome. So you must have guessed Middle East. Now this virus, the virus which is first reported in Saudi Arabia. So it was first originated in Saudi Arabia in the year 2012, and as of 2012 there have been total of 2,578 cases which have been reported in a total of 888 deaths. Now 84% of these cases and deaths have been reported from South Arabia alone, along with other east other eastern Middle East countries. So 84% alone from Saudi Arabia. But since the October of 2021, there have been no cases as such reported, and this information is by the WHO. Next, how did it originate from? So it is not very clear, but it has been believed that the virus originated from the bats, and from the bats it was transmitted to the camels. And how did humans get this infection? Through the camels. So by the camels, sorry, they got this infection by the camels. And how by the camels? Because of direct contact with the animals, by consumption of the milk of the camels, unpasteurized milk, by consumption of raw meat of the camels, the humans got this infection. Now, human to human infection is seen, but it is not easily spread. Now, for one human to get this virus to another human, it is not as easy as how we see in coronavirus in the form of droplets or fomites. For the transmission human to human in MERS-CoV, there has to be prolonged contact. And where can you see prolonged contact? In cases of family members, healthcare workers who are working without proper PP protection, without taking proper precautions. So there has to be a prolonged contact for human to human transmission to be seen. Now, who are the people who are at high risk of developing this infection? The first is travel history. Travel history from the areas where the virus is endemic. Second is healthcare workers who are working without proper precautions, without proper PPE kits. Next is family members. The other family members who are tested positive for the virus. So prolonged contact with family members, the virus can get transmitted. Next is exposure to camels. So people who are taking care of the camels, because they get in contact with the fluids infected, drinking the unpasteurized milk of these camels who are infected with the virus. Next is elderlies because of old age, and also along with the comorbidities. What comorbidities? Like renal failure, diabetes. Another one is immunocompromised people. Immunocompromised are those who are having AIDS, HIV AIDS, transplant patients who have just undergone transplant. Those are your immunocompromised patients. Next, clinically, so how does this infection present? How does this virus present? So first of all, there will be fever, there will be cough, which can develop into pneumonia. Now, pneumonia is a very common thing which happens in this disorder, but it is not seen in all the patients. Next is ARDS. ARDS is acute respiratory distress syndrome. So what is ARDS? ARDS is basically where the level of surfactants in the lungs, in the alveoli, they start to decrease, and because of that, the alveoli, there is collapse of the alveoli. So there is always a risk for developing ARDS. Next is diarrhea, and other than this, there are many other things, other complications, like there can be respiratory complications, can lead to kidney failure as well. Okay, and if the person is having any other comorbidities, it can lead to aggravation of that. Next is, what is the treatment? Now, sadly, there is no treatment, as well as there is no vaccine for this disease. The only way is prevention. And how to prevent yourself? Hand washing. Hand washing for the healthcare workers, for the family members, for the people who are after touching the animals, like the camels, after coming in direct contact with the sick animals. Hand washing, very important. Second is, avoid consumption of raw meat, undercooked meat of the camels. Avoid drinking milk, or should not consume the unpasteurized milk of these animals. or without any like boiling the milk, etc. So these, there is no treatment, there is no vaccination. The only way is prevention. So thank you.